Hi everybody, thanks for checking in. Today we've got Isis.
Hi.
Coolest name of any patient I think I've ever had, Isis. I mean, the Egyptian goddess Isis. Need to meet your parents at some point and have a talk with them about what they were doing when you were born. Isis. Anyway, she came to us because she was in a car accident. And we as a clinic do a lot of personal injury work. And so when she came in, of course, we did a comprehensive consultation, examination. We did a radiographic evaluation. And of course, she had some aches and pains and some sorenesses because he had soft tissue injury. So we embarked upon a course of chiropractic rehabilitation, helping her soft tissues recover. And up behind Celia there on the camera is a radiograph of her lateral cervical spine. So of course we take x-rays to make sure that there aren't any hidden or occult fractures after injury. We want to make sure there's no ligamentous damage, dislocations, that kind of thing. But one of the common things that occurs after a car accident is an alteration to the cervical alignment, resulting in a loss of the normal cervical curve. Right there is her neck, her 7 cervical vertebrae. And although they look nice and healthy, they're not in the right orientation, shape, or position. They are in fact straight when they should be bent. There should be a nice curve in there, about 30 to 32 degrees. So part of the work we're doing is making sure that through the course of her care, that gets restored so that when we're finished with her soft tissue rehabilitation, that is returned to normal. Because if it isn't, what we're going to look at is a lifetime of degenerative change, and in 20, 30 years, arthritis, disc degenerative disease, and of course the pain and discomfort that goes along with it. So we're doing good work now, right? You feeling good?
Yes.
You love the adjustments? Is this your first time being a chiropractor?
Yeah. Yes.
Okay, how's the experience been?
It's been really good. I mean, everything.
Everything's good.
Yeah.
Feel good. Getting adjusted feels awesome.
Yeah.
Feel like you're back to normal.
Everything
Just about.
feels way better. Yeah.
Go face down. Let me check you out.
Okay.
Face down on the table. Let's see how you're doing today. All right. Scoot a little bit to the right side for me. That's good. All right. We got the uniform of winter. We got hoodies and Crocs. Now Isis has a little baby. How old's your baby?
He's 15 months.
15 months. Oh my goodness, what a workload that is. That is a lot of bending and lifting and stooping and carrying and diaper changing and cajoling and feeding. And man, it just never ends, does it? Okay. So we got a left short leg, right long on knee flexion. I'm going to go ahead and start like we often do with the Isis. Just going to use these myofascial guns and loosen up some of those tissues. Of course, in the insurance world, this technique would be considered myofascial release. And we're really releasing the myofascia. We're forcing the Golgi tendon apparati to reflexively relax the musculature that we're working with. So it relaxes muscles and connective tissue and fascia. Of course, it does also stimulate some cellular respiration, increases a little bit of blood flow to the area we're working with. It isn't the most exciting thing to watch on a YouTube video when you're wanting to see, people get adjusted, but it is an important part of the therapeutic process here, at least in my office. I use it frequently. All right. I'm going to start right here. I want you to take a deep breath in, Isis, for me. Hold it right there. Good. We're going to do that one more time and just hold. actually going to do a little hip flexor release on your hip flexors here. Just keep the leg relaxed. I'm going to lift it. I don't want you to lift anything. Don't engage any musculature. Just let me bring that thigh and knee up off the table. And what I want you to do now is go ahead and now engage and pull that thigh and knee back down to the table. So try and get that knee down on the table. Give it all you got. All you got. You're trying. We're in a struggle. It's a titanic struggle. There you go. And then relax it. And I'm just going to do that again. What an increase in range of motion. Look at that. All right. And just hold it for a moment and then do it again. Drive that thigh and knee back down to the table. Good. Excellent. There you go. Quite a bit more range of motion just from the start on this side. Can you feel the difference? Okay. Pull down to the table for me. Pull, pull. Good, and then relax. All right. And pull again. Very good, very good. Good. Nice, strong engagement there. That's good. Isis, I want you to turn on your side. Face me this direction, please. Wonderful. And the other side. Lay flat. Keep the leg relaxed for me. Just another attempt at axial distraction through the ankle, the knee, the hip, acetabulum, sacroiliac joint, and low back. Good. Good. Okay. Scoot back up on the table just a little bit. Right there's perfect. Good. Okay. And I'm going to come in and adjust your shoulders. So go ahead and turn your head that way. You know, scoot down on the table just an inch or two. Good. I got you up too high. And then turn your head the other direction. Right there. Good. Okay. Stay there. Don't move. All right, we're going to use the Y strap on you, so I'm going to have you lift your head up for me. And gather your hair. It gets a little tricky with all that hair and the hoodie. And we're going to just, yep, you got it. Right there, and then drop. Perfect. Okay, not grabbing or pinching anywhere? Good. Good. And then lift for me. That's wonderful. Drop it. There it is. Those were nice adjustments. It's good. Grab my hand. Come up. Turn, just sit right there. Let me just check those shoulders. While I was adjusting your scapula, retracting it off of the thorax when you're face up there, I didn't want to let go very much. So I'm going to actually go ahead and try and adjust that again. Just a slightly different approach. And then, good. Okay, this side. Good, okay. That's it. Isis, easy breezy, quick, right?
Yes.
Job done. High five. Thank you. Thanks, everybody. Appreciate you checking in. Boop. Yeah, we're done.
Okay.
See how